Welcome to Heart and Health, where nurturing and caring is our mission. Heart and Health is a multi-specialty care facility in family medicine and cardiology, specializing in latest technologies in detection of early stage of diabetes and heart disease, in 2 locations in the heart of Long Island, Babylon and Middle Island. Heart and Health is clinically affiliated with Mount Sinai Hospital in New York City. Join host Larry Micarenda and Dr. David Kavesteen as they talk about Lyme disease and how it affects our health and the community.
Hi, I'm Larry Micarenda and welcome to Heart and Health. One of the things that has happened during the past winter, besides it being really warm and everybody having lower home heating costs, is the problem with the insect population, specifically ticks. And ticks carry Lyme disease. And that's why this program. We're with Dr. David Kavesteen from Heart and Health. He's a cardiologist, as well as having a multitude of other talents that you perform medically. One of the things we like to really concentrate on in this half of the program is talking about Lyme disease. First of all, for people who may not know, what is Lyme disease?
Lyme disease is an infection. It's an infection that is caused by the bacteria, Borrelia burgdorferi. This is a specific bacteria, part of the family of the bacteria called Spirochetes. Very specific and very unusual. Lyme disease was discovered by CDC in, believe it or not, the town of Lyme in Connecticut in 1975. And the way that it was discovered was it was discovered, or it was became apparent that there were a lot of unusual cases of juvenile arthritis in a young population. And CDC got kind of curious, said, well, why out of a sudden we have such a high incidence of juvenile arthritis in this town? So they started doing the investigations, and they realized that the disease was infection that caused by the bacteria, which is carried by tick. Notoriously in Northeast, these are like a black-legged tick or deer tick. And after diagnosis of the specific disease, they called that infection Lyme disease. It is basically similar to malaria or any other type of infections. Bacteria is being carried from one host to another host by a vector, which either in malaria is mosquito, and in Lyme disease is tick. Tick is basically a host. It's not anything about the tick itself that causes the problem. It's the infections or the bacteria that live in tick, and the infection that it causes from the bite that produces and become Lyme disease. Now,
For the ones who may not know, what are some of these symptoms of Lyme disease?
You know what? The symptoms of the Lyme disease is very similar to the symptoms of any type of infection. When you get infected by bacteria, you develop malaise, fatigue, weakness, memory loss, and it's acute infections as you were getting infected with any type of bacteria. However, in case of Lyme disease, the infection has 3 different stages. First stage, which is the earliest stage, happens right after the tick bite, when the body gets introduced with the bacteria. And the bacteria causes a cascade of events. Our body are programmed to fight the infections, and the way they do it is by producing autoimmune defense system to kill the bacteria. And as a result, your body feels fatigue, you get muscle pain, you can have neurologic symptoms like headache, you get sensitive to light, you feel tired, your memory loss, you just don't want to do anything. It's the symptoms of the acute case or acute phase of Lyme disease. The infection of the Lyme disease, or Lyme disease itself, breaks down in 3 different stages. The first stage, which is right after tick bite, you're going to see the small rash which just slowly expand. We call it erythema nodosum, which is basically means, or in the lame term, we call it bullseye kind of an infection. Is a significant type of a red rash that it becomes bigger and bigger. Subsequent to that, the bacteria itself in the body multiplies and infects the rest of the organs. It could affect the brain, it could affect the heart, and affect joints. The second stage of Lyme disease is it can affect, which could happen between months or years after. It's joint pain, heart, arthritis, which we call Lyme arthritis. It could affect the heart, cause palpitations, heart block, and cardiomyopathy. And it could, in the last stage of the disease, which is years after, it could affect the nerve system and cause memory loss, cause multiple neurologic deficits, which the symptoms are very similar to the other causes or other neurologic causes, such as multiple sclerosis, rheumatoid arthritis, or fibromyalgia.
Some people have even described the symptoms is almost as if a stroke had came on because of the loss of speech, the shaking, the nervousness. Is that possible too?
Of course. The bacteria itself affects all the organs in the body, and it disseminated through the bloodstreams and goes to the tissue. I actually did extensive research, and I have a very good website, liheartandhealth.com, and it has a few videos and all the information about how it gets disseminated and how it affects the body. But the bacteria itself goes through the tissues and goes through the blood and affects everything in the body and all the organs. However, the major organs that we notice is nervous system, which is your brain, Bell's palsy. They could have signs and symptoms of possible stroke or neurologic deficits. It could affect the heart, that can cause palpitations or heart problem. Or it could affect the autoimmune response of Lyme disease, could affect the joints and develop joint arthritis. And that was the first thing that was discovered in the town of Lyme in Connecticut, where they saw very young people developing arthritis, and they wanted to know why. And that was the autoimmune response to Lyme disease itself.
And Dr. Kavesteen, now just for the audience to know, that Lyme disease, how it's contracted, it's not through personal touching, sneezing, breathing, it's through one way only. How is it contracted?
Very good question. CDC has done a very extensive research to find out the cause and how this has been disseminated through the population. The best way I can bring an example for the viewers is comparing that with malaria. Malaria is also an infection that gets carried by mosquito. Now, Lyme disease is an infection by bacteria and is carried by the tick bite. It does not carry from one person to another person. It's not contagious by sneezing or saliva or other casual contacts. There have been some papers, some articles talking about possibility of being transmitted through sexual contact or from the mother to fetus during pregnancy. However, there is no solid evidence about that at this
So
time.
basically it's inconclusive at this time.
What is conclusive is being carried by the tick bite. And the tick bite has to be significant, meaning what? The tick itself has to have the Lyme disease bacteria in it, Borrelia. And if the tick has the bacteria, the tick has to be in contact with the person for a long period of time, usually more than 24 hours, 24 to 48 hours. The reason for that is not so easy to contact or catch the Lyme disease because you need a specific amount of the bacteria to enter the body to cause the disease itself. So the tick has to be contacted or feeding on the skin for more than 24 to 48 hours to cause the transmission of the disease.
Now, Dr. Kavesteen, how would you diagnose Lyme disease?
Very good questions. Most importantly is we always say that you have to have a tick or a tick bite to diagnose Lyme disease, but the truth of the matter is some of the ticks are very, very small and they infect people in the very earliest stages of their development. So the ticks are so small that sometimes you don't see it. Sometimes the tick is in the hair, sometimes you don't see the rash. That was another signs that people look for. Now, recently we have discovered a very specific type of a test is a blood test that we look for a specific antigen and antibodies that your body produces for that specific bacteria. However, it's very important that there are so many different blood tests to be done. However, there's a specific, very few labs in the United States that they are very specific about diagnosing and finding the antibody that diagnoses Lyme disease.
All right, so somebody has come in, we've diagnosed them, they have Lyme disease. Now, what are the treatment options?
The treatment options, you know, this is something that I think most people don't know. The Lyme disease is something, is a disease that can be prevented and can be cured if it's diagnosed right away. Meaning what? If there is a clinical suspicion that the person has a tick bite, or the person is in the high risk of showing the symptoms of the Lyme disease, the very simple antibody or a very simple regimen of antibiotic can kill the bacteria itself. Usually that course is antibiotics that you take by mouth about 21 to 30 days, and it kills the bacteria itself and the infection goes away. However, if the infection is not treated or goes underdiagnosed, the Lyme disease progresses to the second and third stage. And during that time, the effects and the sequelae of the disease are harder to treat, because your body starts to fight the bacteria and produces autoimmune response to it, and without having the antibody to kill, or without antibiotic to completely eradicate the bacteria itself, you develop some sort of autoimmune reaction that lasts for a very long time. Stage 2 and stage 3 of Lyme disease, it gets treated with the IV intravenous antibiotic, and it's almost a month treatment.
So would people be coming into the office? Would it be outpatient care for something like that, or is it strictly hospitalization?
For the first stage of Lyme disease, it's basically can be done by any primary care doctor in any medical facility. Most importantly is to diagnose the disease and know enough about the disease to find out what it is and what they're treating, and treating it very quickly. If it gets treated very quickly, it can be done in an outpatient setting, it can be done in the clinics. However, if it's not diagnosed and is a stage 2 or stage 3, when the bacteria itself has affected the other organs like heart and brain, then intravenous antibiotic is necessary, and initiation of that treatment mostly gets done in the hospital. However, it can be continued at home with the nurse and other medical staff.
So it can be a very serious condition left untreated. And one of the things, what can the people here on Long Island, as well as other areas that are watching this program, what can they do to prevent Lyme disease?
Prevention goes to the basics. Basically, you want to make sure that you're not in, when you go hiking or when you go hunting or when you even take your pet for a walk, dog, cat, make sure that you are not walking in the grass in a high wood area. Always look for tick to make sure there's no tick attached to you when you come back from trips or when you come back from outdoor. Using any type of repellent for mosquitoes, because those repellents are also effective for repelling ticks and other insects. So keeping a tick away from your body, that's the first step. Covering your body to make sure the tick doesn't cause bite, that's another thing, to make sure you're wearing long sleeves, long pants if you're going to woods. And lastly is knowing the symptoms. I think a lot of people don't know what Lyme disease is, and I think that's one of the mission of Heart and Health and myself, to educate my patients, educate our community about how easy is it to get the disease. However, at the same time, it's also very easy to treat it if you can treat it very early with early detection and prevention. And you don't have to wait for the second or third stage of the Lyme disease, which is very hard to treat. Unfortunately, we see so many people that they get diagnosed or misdiagnosed with other diseases like fibromyalgia, someone who has chronic pain. They they give them the diagnosis of fibromyalgia, and in reality is Lyme disease, or someone who has multiple sclerosis, or someone who has memory loss, or other manifestations of Lyme disease. We are living in a community that Lyme disease is very prevalent, and we have to be very mindful of it, and we have to be very vigilant, and try to detect it and treat it as quickly as we can.
And another problem with Lyme disease is the fact that it's very sneaky and it loves to mimic other diseases. So it really loves to keep people in the medical profession on their toes.
Correct, correct. And the concept behind it is the tick not only carries the Lyme disease bacteria, it also carries other things with it. That tick is also could be infected with viruses, it could be infected with other fungus or other tick-borne diseases, as we call in medical community. And each one of them should be treated differently with a different bacteria, with different antibiotic. You know, you can use one antibiotic to treat all this different infection. Obviously, viruses should be treated with different category of antibiotic than bacteria, so as fungus. So the treatment of the disease should not also not should be specific to the Lyme itself. It should be also towards the co-infections or super-infections that might arise.
So if people in the public who are watching this program would like to know more about it, they can go to your website, heartandhealth.com, which will take them to areas of Lyme disease plus other medical things that they may not know about. And as a service to the public, to educate the public, you host that website. One of the other things that I noticed that earlier today, which Heart and Health does, is another thing that's at epidemic proportions right now, which is diabetes. And we had spoke on other programs about that. I was able to interview one of your diabetic counselors earlier today, and we have some footage of that. And we'll be right back in just a moment after that footage.
Thank you.
You've been watching Heart and Health. Please feel free to visit our website at heartandhealth.com. Heart and Health, where prevention and early detection are the hallmarks of 21st century medical care in the United States. Heart and Health is a multi-specialty care facility in family medicine and cardiology, specializing in latest technologies in detection of early stage of diabetes and heart disease in 2 locations in the heart of Long Island, Babylon, and Middle Island. Heart and Health is clinically affiliated with Mount Sinai Hospital in New York City.